Sagusa.
Yeah. Just if you look a little more. Yeah. Because of treatment.
The chemotherapy drug.
Kwa maita jina yangu naitwa Mary Atieno Olo. From Oyugis. Sasa nimekuja hapa kwa sababu ya ugonjwa ya kansa. Na nimesikia kama mimi nakisachelewa sana. Yaani kama mimi nakisamaliza mwaka 2 sasa hii mimi naanza ya 3. Ndio nilisikia maneno pande hii ati Sori Lake side iko na pale ya kutibu ugonjwa ya kansa. Ndio nikusikia namna hiyo nikakuja pande hii. Sasa mimi nakuja pande hii mwezi wa 3. Sasa mimi nakisakuja hapa mara 2. Hii leo ni ya 3. Na hiyo ya 2 mimi nakisaona tofauti. Kama mimi naanza kutembea, wakati hiyo nilikuwa mimi hapa natembea. Wakati hiyo nilikuwa mimi nakisakuwa kama kichwa yangu naenda pande hii, hawezi ngalia pande hii mzuri. Na kutoka siku hizi sasa mimi naona kama mimi iko ajabu. Niseme tu mimi nakisapona. Nimetumia pesa. Na mimi iko nayo. Na sasa nimechukua kitanda. Na pesa nilitumia pesa. Sasa saa hii ni shilingi 12,000.
So when she came here, she came when the right side, the left side was fully swollen. The breast was swollen, and it was a very big wound on the breast, on the left breast. And so when I inquired more, I found that already she had the histology report that was showing that it was cancer. So we did staging through CT scan, and we also did echo to know how active is the heart, if at all there is anything that is touching it or it is okay. Reason being that the drug that she was to be initiated on is cardiotoxicity, meaning it can really affect the heart if you don't do the ECG before to know the state of the heart. So having done that, we began by doing the dressing. We did our dressing, and then we ordered for the drug to come. After that, we started treating Mary Atieno Olo here in our facility. So at that time, she could not even sleep on that side, the left side. And even the right side, sleeping by the right side would give her a lot of difficulties. So at times she could develop difficulty in breathing. But then what I did is just to reassure the patient that after getting the chemotherapy, she would be well. And just as I told her before, she received the first cycle, went back home. When she came for the second time, the swelling was over. Even as you can see, there is no lymphoedema that was there before. And even the swelling of the neck coming to the shoulder and to the breast has subsided, meaning the drug has done wonders in her life. Actually, with the stage that she was in, we didn't know she'll be good as she is today. But for today, you can see the way she is. She's very good today. She can talk without any difficulty. She can eat without any difficulty. She can sleep without any difficulty. She can walk. At that time, she had to be supported for her to walk?
So far, maybe I should talk also about the other challenges which we have faced. Usually patients present late, given the fact that most of the people in the fishing community first present to the traditional healers. So that's also the biggest challenge is patients present late. When the traditional healers have failed, that's why now they think of referring the cancer patients to the tertiary institutions.
This is a system, or this is a set of systems that allow health professionals to evaluate, to diagnose and to treat patients from a distance using telecommunication devices. Now in this room we have sample telecommunication devices that we use to treat, or that our health professionals use to diagnose and even further treat the patients from a distance. Like most of the cases, we have patients who don't necessarily need to stay within the hospital, but through the system of the telemedicine we are able to see them from a distance. We are able to get them installed into specifications, specified apps that are installed in their phone devices or any other device that can enable them to reach us remotely, so that the patients can be seen by our health professionals.
Mine is just to urge people to come for screening, because when we get this early enough, when it is amenable to cure, then these patients will not bear a lot of burden. I just want to mention that we've improved in terms of screening. When you look at our screening for cervical cancer, in the previous years, like last year, we were doing around 14%. Right now we are at 29%, and I think our latest data, we are surging and we are above the national figures, which of course is 1,866 women per month. But for the past 3 months, we've been doing above that, and that is very positive to our mothers and also people who are within the age bracket.